This patient has been cleansed and prepared already, and one of the things that we're going to address first with our hyperdilute radius is the crepey appearance of the skin in this lower portion of his face. I'm going to do this with a cannula technique. We're using a 25 gauge 1.5 inch cannula. So when we're using a cannula, we want to assess our entry points, being aware of the underlying anatomy. But then we're going to also try to find an optimal entry point that will allow us to cover the largest portion of the area being treated. So I think if we go right in this area for our cannula entry, we'll be able to cover that entire area nicely. So we're just going to use a little bit of lidocaine with epi, 1, 2, 3. So we've had a couple of minutes now. This should be nice and numb. Here we go, 1, 2, 3. So with our cannulas, they provide pilot needles, and the pilot needles are usually 1 gauge larger than the size cannula you're using. Today we're using TSK Steriglide cannula. You guys are, that is one of the partnerships that you have with your Empire membership, so you can get your cannulas through them. They provide you a pretty good deal. The Steriglide cannulas are meant to provide a little bit easier gliding as you're starting to use cannulas, and so it may help. It glides a little bit smoother than some of the other more traditional type of cannulas. In this procedure, we're just going to throw basically small threads of product over the entire area to stimulate collagen. So think about this as spreading a field of collagen seeds to kind of start collagen growth and basically try to help repair some of this crepey appearing skin that we have here. Now for these treatments, it's much different than some of our traditional treatments with radius. In our traditional treatments, we're going to see results almost immediately. So patients will start to get improvement from the filler effect that we have with our radius, which comes in a carboxymethylcellulose suspension and the calcium hydroxyapatite crystals. So our immediate filling is from the carboxymethylcellulose gel, and our long-term results are from the calcium hydroxyapatite crystals. In this case, we've diluted that down because we just want to stimulate collagen growth. And so we will get a little bit of a filling of the tissue from the volume that we place, but our long-term results and the smoothness of the skin, we really aren't going to start to see that for at least 6 weeks or so.